Most men over 50 have been thinking about erections wrong their whole lives, and no one told them. You think it is about hardness at the start, but here is what matters more: staying hard all the way through. Because what good is getting there if you lose it halfway? That moment when you feel yourself softening during intimacy, when you have to stop and hope it comes back, when you see the disappointment or confusion in her eyes, that is not just frustrating, it is humiliating, and it makes you want to avoid intimacy altogether. But here is what you need to know. Losing your erection during sex is not about low testosterone, it is not about age, and it is not permanent. There are 8 specific reasons this happens to men over 50, and every single one of them can be fixed. You have been told this is just what happens when you get older, that you should be grateful you can still get an erection at all, that maybe you should just accept it and move on. But that advice is garbage, because the truth is, most men losing their erection mid-act are making simple, fixable mistakes. Mistakes with their breathing, mistakes with their positioning, mistakes with what they ate 3 hours earlier, mistakes they do not even know they are making. And once you understand what is actually happening in your body during sex, you can fix it. Not with a pill, not with some expensive treatment, with awareness and adjustment. I am Dr. Mariana, a board-certified urologist and men's health specialist with over 14 years of clinical experience. I have sat across from hundreds of men who came into my office embarrassed, frustrated, and afraid that their intimate life was over. And I have helped most of them get their reliability back. Not through surgery, not through complicated protocols, through simple corrections that address the real mechanical and physiological reasons erections fail mid-act. What I am about to share with you are the 8 most common fixable causes I see in my practice every single week. Before we dive in, I need you to do something for me. If this kind of direct, shame-free medical guidance is helpful to you, hit that like button right now. It tells me this content is reaching the right people. Subscribe to this channel so you do not miss future videos. And leave a comment telling me where you are watching from. I genuinely want to know if you are tuning in from California, Florida, the UK, or anywhere else. This community of wise, health-forward men and women is growing, and your engagement matters. Now let me walk you through the 8 reasons men lose their erection during sex, and what to do about each one. The first one is shallow breathing. When you get aroused, your heart rate increases. Your body needs more oxygen. But most men, especially when they are anxious or trying hard to perform, start breathing shallow and fast, up in their chest. That shallow breathing triggers your sympathetic nervous system, which is your fight or flight response. And fight or flight is the opposite of arousal. It constricts blood vessels. It redirects blood away from the penis and toward your major muscle groups. It is your body preparing to run from danger, not to have sex. Think of it like trying to start a fire while pouring water on it. Your arousal is the flame. Shallow breathing is the water. The solution is deliberate, deep belly breathing. Breathe in through your nose for 4 counts, deep into your lower abdomen. Hold for 2. Breathe out slowly through your mouth for 6 counts. This activates your parasympathetic nervous system, which is the rest and digest mode your body needs to maintain an erection. Do this throughout intimacy, especially if you feel yourself starting to lose hardness. Conscious breathing is one of the most underrated tools for bedroom reliability. The second cause is performance anxiety that creates a feedback loop. You lose your erection once, it shakes you. The next time you are intimate, you are worried it will happen again. That worry becomes a distraction. The distraction pulls you out of the moment, and being out of the moment kills arousal. Your brain is no longer focused on pleasure or connection. It is focused on monitoring your erection, which is like trying to fall asleep by thinking about falling asleep. It does not work. The more you think about it, the worse it gets. This is not a physical problem, it is a mental trap. And the way out is to shift your focus entirely. Stop monitoring your hardness. Focus on sensation instead. What does her skin feel like? What does her breath sound like? What feels good in this exact moment? Pleasure is a distraction from anxiety, and when you immerse yourself in pleasure, your body takes care of the rest. If you catch yourself checking in on your erection, redirect immediately. Touch, taste, sound. Bring yourself back to the present. The third reason, and this one surprises most men, is dehydration. Your blood is about 55% water. When you are even mildly dehydrated, your blood volume drops. That means less blood available to fill the erectile tissue in your penis. It also means your blood gets thicker, which makes it harder to pump efficiently. Think of it like trying to drink a milkshake through a narrow straw versus water through the same straw. Thicker liquid, harder flow. Dehydration also reduces nitric oxide production, which is the chemical signal that tells your blood vessels to relax and let blood flow in. If you are not drinking enough water throughout the day, your erections will suffer. Most men do not connect the two. They think hydration is about avoiding headaches or kidney stones, but it is also about circulation, about blood flow, about keeping everything running smoothly. The fix is simple. Drink water consistently throughout the day, not just when you are thirsty. Thirst is a late signal. By the time you feel thirsty, you are already dehydrated. Aim for half your body weight in ounces daily. And if you know intimacy might happen later, hydrate well in advance. Here is something I want you to think about right now. How many of these three causes do you recognize in yourself? Have you noticed shallow breathing during sex? Do you monitor your hardness instead of enjoying the moment? Are you drinking enough water? Take a second and be honest with yourself. Awareness is the first step to change. The fourth cause is poor positioning. Certain sexual positions require you to engage your core, your legs, and your glutes intensely just to maintain the position. And when those large muscle groups are working hard, they demand blood flow. That blood gets redirected away from your penis and into your thighs, your abs, your lower back. You are essentially competing with yourself for circulation. Standing positions are the worst offenders. So are positions where you are holding yourself up with your arms or balancing awkwardly. Your body does not care about your erection when it thinks you are about to fall over or collapse from exertion. The fix is to choose positions where you can relax, where you are not fighting gravity or straining to stay balanced. Lying on your side. Seated positions. Anything where your large muscle groups are at rest and blood flow can prioritize where it needs to go. This is not about being lazy. This is about being smart with your body's resources. The fifth reason is alcohol. Even a small amount of alcohol is a vasodilator, which means it widens your blood vessels. That sounds good in theory, but in practice, it makes it harder to maintain the blood pressure needed to keep your erection firm. Alcohol also suppresses your central nervous system, which dulls the signals between your brain and your penis. One or two drinks might lower your inhibitions and make you feel more relaxed, but three or more will almost guarantee you lose your erection mid-act. And here is the tricky part. The effect is dose-dependent and individual. Some men can handle one drink, others cannot. You have to know your own threshold. If you notice a pattern where you lose hardness after drinking, the answer is obvious. Skip the alcohol before intimacy. Save it for after. Your performance will thank you. The sixth cause is eating a heavy meal too close to intimacy. Digestion requires significant blood flow. When you eat a big meal, especially one high in fat or processed carbs, your body redirects blood to your stomach and intestines to break down that food. That means less blood available for your penis. It is the same principle as exercising right after eating. Your body cannot do both efficiently at the same time. On top of that, a heavy meal spikes your insulin, which can temporarily reduce nitric oxide availability. The result? You might get an erection, but you cannot maintain it. The fix is timing. If you know intimacy is on the table later, keep your meals light. Lean protein, vegetables, healthy fats. Nothing greasy, nothing heavy. And leave at least 2 to 3 hours between eating and intimacy. Give your body time to finish digesting so it can focus on what matters. The seventh reason is chronic pelvic floor tension. Your pelvic floor muscles support erectile function. But if those muscles are chronically tight, from stress, from sitting all day, from poor posture, they cannot do their job properly. Tight pelvic floor muscles restrict blood flow in and out of the penis. They also make it harder to relax during sex, which, as we have already discussed, is essential for maintaining an erection. Most men have no idea their pelvic floor is even involved. They think erectile function is all about the penis itself. But the pelvic floor is the foundation. If the foundation is unstable, everything above it suffers. The solution is pelvic floor relaxation exercises. Not Kegels. Most men do not need to strengthen their pelvic floor. They need to learn how to relax it. Diaphragmatic breathing, hip stretches, and reverse Kegels, where you gently push out instead of squeezing, can make a massive difference. This is something I walk patients through regularly, and the improvement in bedroom reliability is often dramatic. The eighth and final cause is medication side effects. A huge number of common medications interfere with erectile function. Antidepressants, especially SSRIs, blood pressure medications, particularly beta blockers and diuretics, antihistamines, acid reflux medications, even over-the-counter allergy pills. These drugs either reduce blood flow, interfere with nerve signaling, or lower libido, and sometimes all three. The problem is, most men do not connect the dots. They start a new medication, their erections get worse, and they assume it is just aging. It is not. It is a side effect, and it is fixable. If you are on any medication and you have noticed a decline in bedroom reliability, talk to your doctor. There are almost always alternatives. Different classes of blood pressure meds, different antidepressants, different approaches entirely. Do not just accept it as the cost of treatment. Your sexual health matters, and there are solutions. Let me tell you about a patient I worked with a few years ago. His name was Tom. He was 64, and he came to me because he kept losing his erection during sex with his wife. He said it was destroying his confidence. He could get hard initially, but within a few minutes it would fade. He thought it was low testosterone. We tested him. His testosterone was fine, so I walked him through his typical routine before intimacy. Turns out, he was drinking 2 glasses of wine with dinner, eating a heavy meal, and then trying to initiate sex an hour later while lying in positions that required him to hold himself up with his arms. On top of that, he was on a beta blocker for blood pressure. We made 4 changes. Switched his blood pressure medication to an ACE inhibitor, cut the wine before intimacy, lightened his dinners, changed his preferred position to something where he could relax. Within 2 weeks, he called me and said, "I feel like I am 30 again." He did not need testosterone. He did not need Viagra. He just needed to stop working against his own body. I want to address something I hear constantly in my practice. Men tell me, "It is too late for me. I am too old. My body does not work like it used to." And I understand that feeling. When something stops working reliably, when you have tried things that did not help, when you feel like your body has betrayed you, it is easy to give up. But here is what I have learned after 14 years of treating men. It is almost never too late. What looks like permanent decline is usually just accumulated bad habits and unaddressed root causes. Your body has not given up on you. You have just been fighting it instead of working with it. And there is a dignity in reclaiming your intimate life that goes beyond performance. It is about refusing to be defined by limitations that are not actually real. It is about taking ownership of your health and your pleasure. That dignity is yours. You just have to reach for it. So here is your action plan. Start tonight. Number 1. Practice deep belly breathing every day, not just during sex. Number 2. If you drink before intimacy, cut it out for 30 days and see what changes. Number 3. Eat lighter dinners and wait at least 2 hours before intimacy. Number 4. Choose positions where you can relax instead of strain. Number 5. Drink more water throughout the day. Number 6. If you are on medications, talk to your doctor about alternatives. Number 7. Start pelvic floor relaxation exercises. Number 8. Stop monitoring your erection and focus on sensation instead. Pick 3 of these. Commit to them for 30 days. Track what changes. I am confident you will see improvement. If this video helped you, make sure you like it and subscribe to this channel. And here is what I want from you in the comments. Which of these 8 causes hit home for you? Was it the breathing, the positioning, the medication? Let me know. Your honesty helps other men realize they are not alone in this. Aging is not the end of vitality. It is an invitation to live smarter. Your age is not your limit. Your awareness is.